my name is Tatiana Savage, and today I will be demonstrating venipuncture for blood collection. The first step will be to check the doctor's orders. The second step will be to gather my supplies. Here I have a vacutainer holder for the tubes. I have my vacu tubes. I have my tourniquet, 2x2 gauze, my alcohol pads, a bandage, my needle that is compatible with my vacutainer, and my biohazard bag. After I have gathered my supplies, I'll perform hand hygiene. Now I'll identify my patient and explain the procedure to the patient. After I have done that, I will screw the rubber part of the needle into the vacutainer, and then I will place one of the tubes into the vacutainer, making sure not to advance it all the way. I will tie a tourniquet onto my patient on their non-dominant arm, and making sure that it does not stay on longer than 2 minutes. Making sure this is really tight. Okay, after I've done that, I will check for the peripheral vein on my patient. I found it, and I will check to make sure I have the correct patient. After I've done that, I will clean the site with an alcohol pad in a circular motion from the inside outwards for 30 seconds. And I want to make sure that the area is sterile after cleaning and is not touched or touched near it. So everything stays sterile. All right, so now that I have cleaned all of that, I'm going to don gloves. Oops, I did that backward. Okay. Now I have donned my gloves, I'm going to remove the sheath from the needle. I'm going to hold the patient's skin tight by pulling downward with my fingers to make sure that the vein is prominent. I'm going to make sure the bevel is placed upwards, and it is placed upwards. I will advance the needle into the vein, check for blood, advance just a little bit more. I will fill my tube as full as needed, as ordered. I will remove my tube and fill a second tube as full as needed and ordered. Once that is done, I'll place a cotton ball on here, remove my tourniquet, and then I'll remove my needle, making sure to place it into a sharps container immediately. I'm going to label my vacu tubes, and I'm going to place them into my biohazard bag. If you have an order, place it into the sleeve. After I have done that, I'm going to make sure my patient is positioned for comfort and safety, and then I'm going to document the procedure and send these off to the lab.